Here we go with COVID again. It doesn't seem to end. Today, Christmas Eve, lines are wrapped around buildings waiting for COVID testing. Everybody believes they have this new pandemic virus. And it seems to be spreading like wildfire. But those that have had it, and I honestly think I did, don't have much in the way of symptoms. Some achiness and some sinusy things maybe for a day or two. And then it just goes away. So even those that are vaccinated, even though Sir Lord Biden is trying to scare you and play the Grinch here at Christmas time, and his only message for us has been death and doom and decay, we're going to give you hope. Now, we're going to talk today about blood pressure control. If you have blood pressure during this COVID mess, it's probably going to go up a bit. So we're going to give you some ideas there as well. Stay tuned. The information you hear on the Nutrition Shop Health Talk with Dr. Len is strictly educational and is not intended to diagnose or treat any disease. Any healthcare decision should be discussed with your health professional. And now, here is Dr. Len. 50% of all Americans over the age of 30 are now said to have high blood pressure. We have the highest blood pressures in the world. I wish I could say that that's a good thing, but it's not. And out of those 50% of us, 75% of all of those are above the acceptable limits. Ugh! And now COVID is pushing us to the breaking point. Stay tuned. During this pandemic, they're saying the average increases in blood pressure each month range from 1.10 to 2.50 millimeters of mercury higher for systolic, that top number. She said a friend of mine in the office, and his systolic numbers for the last number of weeks have been higher. And even though he's on a blood pressure medication, the systolic pressure is up. He's concerned. According to the American Heart Association, half of American adults have high blood pressure and the leading cause of heart disease, and nearly 75% of all cases remain above the recommended blood pressure levels. Staying at home orders were implemented across the U.S. from March to April of 20 in response to COVID-19. This resulted in a shift to remote health care, which had a completely negative effect on healthy lifestyle behaviors for many people. Listen up, Joe Biden. You lock people down, their blood pressure went up. You lock people down, they don't get to the doctors. You lock people down, and you're killing people. And the lockdowns have not been proven to do squat with COVID. You killed our economy, and you want to do it again. For this analysis, researchers assessed de-identified health data, de-identified, so nobody knew who they were, from employee wellness plans. The data included 500,000 adults. They were listed as either normal, elevated stage 1 hypertension, or stage 2. The researchers compared monthly average blood pressures between 2018 and 19 versus what's going on now with COVID. Higher increases in blood pressure measures were seen among women for both systolic and diastolic. Men just mostly systolic. From April to December 20 compared with pre-pandemic time frames, more participants, 26.8%, were recategorized into a higher blood pressure category. Unbelievable. From a public health perspective, during a pandemic, getting vaccinated and wearing a mask are important, they said. However, the results of our research reinforce the need also to be mindful of chronic health conditions, such as worsening of blood pressure. Even in the midst of the pandemic, it's important to pay attention to your blood pressure. Study authors were following up on results to find out if this trend continued into 2021, which would indicate a forthcoming wave of COVID-related strokes, heart attacks. How's your blood pressure? You know, you may really want to make a New Year's resolution soon to come and sit down with us and discuss your health and do what we call a consult. Listen up. Hi, everybody. This is Dr. Len, and I want to talk to you today about a consultation, a nutritional consultation. What's that all about? It's what we do. It's a personal one-on-one time that we put aside, whether it be via social media or Zoom or in person, where we can have the ability to work closely to enhance your health. The aim is to enhance your bodily functions, alleviate symptoms of illness, improve your lifestyle through a nutritional intervention. Some people simply want to undergo a diet to ensure they're eating correctly and avoid illness. Other people have medical problems or are suffering from various symptoms that they believe can be alleviated by making nutritional changes to their diet. Other common reasons to undergo a consultation include a desire to lose weight, digestive issues, skin complaints, low energy, lethargy, stress, fertility issues, competitive sports, the list goes on. Before your consultation, we'll ask you to complete a comprehensive questionnaire. This questionnaire will focus on all aspects of your diet, lifestyle, medical history, medications you may be taking, current health concerns, and really importantly, your goals. We may also ask you to do a food and drink diary for those 3 days, maybe up to a week, so we can document everything you eat and drink during that time. Once you've completed this questionnaire, we'll look it over, and then we'll have a one-on-one consultation, usually about an hour to an hour and a half. And during that time, you'll talk through the questionnaire and diary as well as discuss your lifestyle, your current exercise regimen, your health concerns, your family medical history, your existing symptoms, and really importantly, again, your goals. You can also discuss underlying emotional issues that may be affecting your mood, eating patterns, lifestyle. During this in-depth discussion, you may be asked to do some functional tests, saliva, blood, etc., to try to pinpoint specifically what's going on. Once we have a full and complete picture of your current nutritional, physical, and emotional situation, we'll develop a plan for you. That may involve some nutritional dietary issues, working with our dietitian, working with our chef, or supplements. We can add those to the regimen as well. Vitamins, minerals, fiber, fatty acids, amino acids. But to get the most out of a nutritional consultation, you need to be as frank and honest as you can. The more complete picture that we have of what's going on in your system, the better that we can help you. If you're interested in getting started, give us a call, 678-228-8900, or reach out to us through our website at thenutritionshop.net. You know, as we wrap up this pre-Christmas idea, I want to wish each and every one of you a Merry Christmas and a Happy New Year. We'll talk again next week. I'll be doing the show starting again on Monday. God bless you. If your pressure's up, seriously, let's talk. Don't let that become a problem. Don't let you become a Joe Biden COVID casualty. God bless you, folks, and we will see you back here next week. Again, the number at the office, 678-228-8900. God bless. Take care.